Hollows? Bags? What are these exactly? What filler is best? Or should I just get blepharoplasty? I'm 45 and I've had these all my life. They are genetic from my father's side. I'm ready to get rid of them for good, but honestly, I don't know the best course, filler or surgery. I can afford filler now, but I can wait 3 or 4 months and afford surgery if that's a better option in the long run. But if I opt for surgery, I really want to know that they will be gone for good.
Thank you for your question. At the age of 45, you're at a point in time where you're trying to make a decision about what to do about the appearance of the area under your eyes. So, as a cosmetic oculofacial plastic surgeon, I deal with this kind of concern every day of my practice. And your question is it a good idea to do fillers or whether to wait and do something more definitive, such as surgery? So, in order to define a solution, we have to define the problem. So, in reviewing the photo you submitted, there is the appearance of puffiness, some fine lines and wrinkles, and possibly some discoloration. There's a little bit of shadowing to the photo, but I think that overall I have a good sense of what your situation is. Understanding that the puffiness under the eyes is represented by something called lower eyelid fat prolapse. Now, lower eyelid fat prolapse means that the puffy bags that are around the eyes pushes forward. And typically this is a genetic trait that can start as early as the teen years and will further develop or become more pronounced as you get older. Now, the strategy, just to understand what the filler idea is, the strategy around fillers is to try to fill the hollows to camouflage the appearance of the bulge of the fat pockets. Well, unfortunately, that strategy is used a little too often by non-surgical physicians, and they end up creating these bags under the eyes that are even more pronounced. So, I'll explain to you how I would approach your situation in my practice. What I would do is address the fat pockets on the lower eyelids through a procedure called transconjunctival blepharoplasty. Now, transconjunctival blepharoplasty means addressing the fat pockets by reduction and repositioning from behind the eyelid. Now, the reason for that is to minimize external scarring as well as to maximize the integrity of the anatomy of support under the eyelid. You see, a lot of times when people have lower eyelid blepharoplasty from the outside, a general plastic surgeon unfortunately doesn't always don't know enough about all of the structural issues, and unfortunately sometimes people will develop lid retraction or ectropion, which means the eyelid being pulled down or pointing outward. This isn't by no means is meant to frighten you, but it's understanding that the strategy is to minimize the impact of the surgical trauma and create a natural appearance. Now, to deal with the fine lines, wrinkles, and the discolorations, which are typically cumulative over a lifetime of both age-related genetics and sun exposure, we use a combination of fractional CO2 laser, which is a technology where thermal energy is focused in a very specific way to cause contraction and tightening of the skin, and therefore result in an improvement in overall fine lines and wrinkles, as well as a certain amount of resurfacing of the skin. Another thing that we do that's we're kind of unique at is the use of platelet-rich plasma. Now, this is your own blood that is spun down, and the same technology and concept of using platelet-rich plasma, the active part of healing that's used by orthopedic surgeons, for example, for athletes who have tendon injuries and joint issues, we have been successful in using for under-eye fine lines, wrinkles, discolorations, and dark circles. So we would use this at the same time as the surgery. Therefore, we not only address the puffiness, but we also address the skin quality. Now, understanding how this impacts your face overall will be important so that you can get a sense of what to expect afterwards. After the procedure is done, you'll have an opportunity to now look at your face in a different light, if you will. And something to just be aware of, and something to discuss as you do your consultations, is about the volume loss that occurs in the eyelid to cheek area. I wrote a book a few years ago called The Fine Art of Looking Younger. And what I explained is that facial aging is volume loss, which includes bone, muscle, and fat, as well as descent. So when you look at facial aging, yes, the puffiness is a dominant feature, but understanding it in the context of other areas that may need to be addressed or would benefit from improvement, you can get a sense of the overall strategy. So that's what we typically do. We discuss these possible choices so that people know what to anticipate and how to plan what they'll do for themselves afterwards. For example, for the area underneath the eyelid, where the eyelid and cheek junction is, we'll typically use a filler like Restylane or hyaluronic acid. We'll often combine it with platelet-rich plasma to get that extra volume enhancement and skin quality improvement. We'll look at the area under the eye at the eyelid cheek junction and actually fill that area with a filler like Restylane or PRP or combination so that we can get the maximum benefit. In addition, to address the cheek area, we'd use a filler such as Radiesse or Sculptra. For people who have more advanced issues, we will even place a surgical submalar implant. So there's a strategy, and I think that in your situation, the surgical option is probably the more definitive and practical and will yield the most satisfying aesthetic result. At this point, I suggest you meet with qualified and experienced cosmetic surgeons and learn about their individual styles and how they do their surgery. And then once you find one that you resonate with, go ahead and move forward. So in review, I'm recommending transconjunctival blepharoplasty, PRP fractional CO2 laser combination to rejuvenate the under eye puffy area, and then to consider fillers to even further enhance the overall look of the whole face. So I hope that was helpful, and thank you for your question.